So this is obviously something that we are going to sort of touch base on. But when you see someone with an injury, what's the first thing you do, Dimitris?
So apart from taking a history on whether there is an acute injury in place and clinically examining the patient to verify the injury, the next step is to be also legally protected and to explain to the patient the extent of the injury, is to do either an ultrasound scan or an MRI scan. Now, the ultrasound scan, I'll be honest with you, it's more easily accessible, and it can dynamically assess the tendon, okay, and it can give you an estimate of whether the tendon is close to its attachment, where the radial tuberosity, or whether it has retracted. On the other hand, if you do an MRI scan, you can actually show the patient, like in this case, where this was a 6-week-old bicep tear, that it has really retracted from the point of recession to at least 10 centimeters. And in that way, you can quantify the injury, and then you can give the patient also an insight on what you are planning to do and where this tendon should lie. And you can do your preoperative planning also based on this. For example, if with this kind of extensive injury, which is more than 6 weeks old, most likely you will have to do two small incisions in the anterior aspect of your arm. Whereas if it's very slightly displaced, then you can do just a single incision around the area of the forearm. So it's for preoperative planning and also to give the patient an insight on what to expect from the operation.